Italy. Italy right now is in the midst of a full-blown public health crisis. The country is completely on lockdown. Today, a new measure announced. Italy announced it will stop almost all commercial activity aside from supermarkets and pharmacies. Think about that for a second. Everything closed except for drugstores and food. Italy also announced today they now have over 12,000 cases, and the total deaths in the country have increased, listen to this, have increased over 30% in just 24 hours, from 631 to 827. 30% increase in fatalities in one day. This chart shows the rapid growth of cases in Italy. Does that look familiar? It should. You can also see how the US is right now following almost the exact same trajectory, just a week behind. Now, many, if not most of those deaths in Italy are likely a direct result of what we have already seen with this virus in Wuhan, China. The virus is overrunning the healthcare system capacity. Anywhere in the world, at any given time, in any given city, there's a fixed amount of doctors, ICUs, beds, ventilators. The systemic risk the virus poses to everyone around the world right now, including in the US, is what is happening now in Italy. Doctors in that country are intubating patients in hallways. Massive numbers of healthcare workers are infected. They are having to make wartime triage decisions about who they can afford to treat. The Atlantic reports on a remarkable document issued by an Italian medical college that recommends doctors allocate their stretched resources to patients with the highest chance of recovery. Italian doctors are being forced to decide who to save and who to let die. Tom Boser, Trump's former Homeland Security advisor, told NBC News yesterday that we are 10 days away from the hospitals getting creamed. We are now 9 days away. That is where we are headed right now in this country. The only thing we can do at this point as citizens, as civil society, because the testing has been screwed up inexcusably by the federal government, is to take dramatic steps collectively to socially distance ourselves, to try and flatten the curve of this epidemic and slow the transmission of the virus in order to stop a run on our hospitals, to protect vulnerable populations in our midst. That's older people, people with serious chronic medical conditions like heart disease, lung disease, and diabetes. We all have people in our lives that are vulnerable to this. And the clear steps to take are canceling large-scale events and reducing travel, reducing going out, even going to restaurants or events. We need to take this all deadly seriously. You can go read the warnings from Italians who said we did not take this seriously enough and now we are in it. That's their message to us. That message, however, is not being adequately communicated at all by the most powerful person in the country. Someone we'll be hearing from later tonight, a man who insists on propagating disinformation and meeting with CEOs to discuss an economic problem. But the right message is being communicated by people in administration like Dr. Fauci, by former Trump administration officials like Tom Boser and former FDA chief Scott Gottlieb, by governors like Washington's Jay Inslee, who today announced they are shutting down events over 250 people.